How many of you have a uterus or care about someone who does? I think that covers just about everyone. So we can all agree that uterine health is really important. And yet the death rate for uterine cancer is rising faster than that of any other cancer type, with more diagnoses and deaths today than ever before. Although many cases of uterine cancer are detected early and can be successfully treated with surgery, this just is not an option for a significant number of patients, such as those who wish to preserve their fertility. Now, for patients who cannot undergo surgery, the primary treatment alternative is hormone therapy with progestins. To understand how these drugs work, we can think about hormone cycling in the uterus. A healthy uterus relies on a precise balance between two hormones, estrogen and progesterone. Estrogen promotes the growth of the lining of the uterus, while progesterone counteracts estrogen's effects to maintain tissue health. However, when there's too much estrogen and not enough progesterone, this can lead to uncontrolled cell growth, ultimately causing cancer development. Now, progestins are drugs that were designed to mimic the action of progesterone, restoring that critical hormonal balance in the uterus. Although many patients initially respond really well to these therapies, the effect is unfortunately often temporary, with up to 40% of patients experiencing a recurrence. That being said, there are currently only 3 progestins used to treat uterine cancer in the clinic. Yet over 20 different progestins, 20 have been FDA approved for other uses, such as contraception. Now, this means that there may be a more effective progestin hiding in plain sight, and we would have no idea. And that's where my research comes in. My thesis aims to identify the most effective progestins for treating uterine cancer. To approach this objective, I utilize cutting-edge 3-dimensional cell cultures generated from patient tumor tissue, also known as organoids. You can think of organoids as tiny tumors. They are unique to each patient, and they allow for detailed examination of cancer cell behavior. By treating these organoids with various progestins, I can monitor how they are responding in real time using a technique called live cell imaging. Excitingly, I have already identified several progestins that are outperforming those routinely used in the clinic, providing hope to the tens of thousands of patients diagnosed with uterine cancer in the US each year. Now, for the remainder of my PhD, I will continue testing these progestins to identify which is most effective so that every patient with uterine cancer can receive the care that they deserve. Thank you.